New videos every day.
This is Athena Jezik, and we're going to do a little work on the legs. When I work on legs, I like to make sure that the legs are aligned properly, sometimes from the hips, and sometimes people have a little bit different placement of their leg. So I'm going to rotate slightly her leg, and you can see that there's a little bit more of an outward rotation with her foot. And I'm going to do the same thing with this and rotate it like so. And that way we have a nice straight balanced leg coming off of their hips. Okay, starting with a little bit of oil. We'll start with this leg over here. You can apply the oil going down, from the ankle upward or upward downward. There's not really any way of doing it properly or improperly, just whatever works for you. Okay, I'm just going to go through a typical massage routine that I do for the legs, starting down at the heel, coming up through the gastrocnemius muscles and soleus, and working 4 little, just going around the muscle. You can think of it as going on the edge, right along the bone in the front. You can kind of feel the bone through a lot of that muscle, but you're really on the edge of the muscle. I can feel the bone a little bit through the muscle. And then I come through the belly of the muscle, between the two muscles, between the kind of the belly and then the edge again. And this one is easier to feel the bone. Then crisscrossing across the muscle, like a cross fiber. Working like so. I come to the side then and work another one back down, but this time I pick up the muscle a little bit more because of the position that I'm in. So I go down and just grab the whole thing, but you want to be careful not to squeeze, grab real tight. You don't want to make it uncomfortable for people, because a lot of times the calf muscles are a little bit tender. They have a lot of action where there's a lot of flexion and shortening. They don't get lengthened quite like some muscle groups. So excessive amounts of shortening makes for a little bit of tenderness when working into it. The more involved a person is with running or sports, you're going to notice a difference in the tension of the calf muscles. And then again, we don't want to cover over the knee area. We don't want to go over that with any kind of thumb iron or anything like that, but we can go to the side of the knee and work up through and I just come to the top of the knee on the rest of the hamstring muscles and work up, and then on the side to this iliotibial tract, working along the long way. And then now I'm just brushing down. You'll see a little bit more of this as we get to the other side. And rotating the thumb, I'm just lifting the muscles up. And here we go, across the muscle. What I mainly do is I work the different stroking moves that massage has. I just combine them and just work what works. After you learn the muscles real well and you understand how they operate, what loosens them, what tightens them, your work will change. You're not going to be quite so regimented in the box that you learned from. for instance, I rarely use deportment, which is the beating. I rarely use that because I just don't find that for the work I do that gives much benefit. Although there are times when I do stimulate with circulation using a little bit of deportment with wide open fingers. So it's very soft deportment. We'll follow up on the same routine, other leg. I want to take the time here to say thank you to those of you who have emailed me with very generous, kind words and appreciation. And I want to say that it really surprises me that so many people are getting good things out of this and they're finding help and inspiration from the work that I do. So thank you for your emails. And again, as you notice, I'm doing this probably a little too fast, but coming up those sides, the belly, the middle, the belly, and the side again. I wouldn't recommend for people to work quickly with muscles until they've had quite a bit of practice with it. Because quick work, in order to be thorough with quick work, you really do have to have a good idea what you're doing and be very familiar with how the muscles respond. So I might be working a little quicker than some. I am still getting very into the muscle and everything is getting done that needs to be getting done. A little bit of tightness right along here. Okay, we have this camera issue here, so just push ourselves up this direction. There's a fading bruise. It's not at any point where it's really got anything going on, so I'm not concerned about the way that this bruise looks this time. It seems to be something that she keeps hitting herself in the same spot. And sometimes it gets a little more of a discoloration than actually having a bruising. And then down the iliotibial tract. Although because that's there, I'm going to just go around it a little bit. Like I say, that's not the color or the way that I'm overly concerned with that this time. Okay. And coming back down to give the legs a stretch. I always kind of pull the whole leg. Now when you do a stretch, there's different ways of doing a stretch. You can just like grab and just pull, or you can grab and you can just kind of get yourself interfaced with the fascial structure and then pull as if you're pulling a tablecloth on the top of a table. Rather than pulling deeply, you're pulling more shallow and making a little bit of an arc in the direction of the pull. It's something maybe I can explain at another time. It's a technical thing and it has a very definite feeling to it when you're doing it. And the person on the table can notice a difference between the two different kinds of traction type pulls. Okay, this is Athena Jezik. Thank you very much for your time.